You have seen the stories. A phone snatched out of a hand, a chair pinned to the machine, and somewhere in the back of your mind, a harder question forms. What about the metal that is already inside me? The clip from your surgery, the plate in your knee, the ink in your tattoo. If you have ever wondered whether an MRI could rip the metal out of your body, you are not alone. It is one of the most searched questions patients ask before their first scan, and one of the most misunderstood. That fear makes complete sense. You are being placed inside one of the strongest magnets you will ever encounter, and you know there is metal in your body that you did not choose to advertise. Many patients feel exactly this, that if the magnet is that strong, surely it must be pulling on something. It is a reasonable worry, and it is also why nobody reaches this table by accident. Think of your technologist as the pilot for this mission, and the radiologist as the commander. And before either of them lets you near the magnet, there is a checklist that has to clear. Here is what is actually happening. The MRI's main magnet is always on, a powerful, patient presence, like a discerning detective who reacts to only one specific clue. That clue is a particular kind of metal. Magnets do not grab all metal. They pull hard on what we call ferromagnetic metals. Think ordinary steel, iron, but they barely notice others. Picture a fridge magnet. It clamps onto your steel refrigerator door, then slides right off an aluminum can. Here is the part the horror stories leave out. Most modern implants, titanium hips, knees, many surgical clips, most plates and screws, are made from materials the magnet treats like that aluminum can. They are chosen in part because the magnet barely reacts to them. This is where the crew steps in. Before you ever approach the door, every implant is checked against its safety rating. MR safe, MR conditional, or MR unsafe. The way a film set runs a metal detector at the stage door before anyone walks on. And if the scanner could say one thing for itself, it would be simple. I only pull on what I am built to notice, and I am checked before every take. Let us clear up what the stories get wrong. Myth: any metal at all means you can never have an MRI. Fact: most patients with implants can be scanned safely. The team just needs to know exactly what you have and where. Myth: the magnet will tear an implant or a filling loose. Fact: most modern implants in dental work are non-magnetic or firmly fixed in place, and they are cleared before your scan. Myth: your tattoo will be ripped off or badly burned. Fact: serious tattoo reactions are rare. Some older inks can feel briefly warm, and your team takes simple precautions if needed. Myth: the magnet gets switched off between patients. Fact: the main magnet is always on, day and night, which is exactly why screening for loose metal matters so much. Myth: the real danger is the metal inside you. Fact: the greater danger is loose metal in the room, an oxygen tank, scissors, keys, which is why the screening and the warning signs are so strict. A few things make the process work for you. Tell your care team about everything, every implant, every past surgery, any device, and even old metal fragments or shrapnel. If you have an implant card, bring it. Remove everything removable: jewelry, hairpins, keys, coins, and your phone. Mention tattoos and permanent makeup, and answer every screening question completely and honestly, even the ones that feel minor. That interview is not a formality. It is how the team checks each implant against its safety rating and confirms you are cleared before you ever reach the magnet. You are never guessed about, you are screened. So here is what to remember. First, the magnet only pulls hard on certain magnetic metals, and most modern implants are not those. Second, screening exists to identify exactly what is in and on your body before you ever enter the room. And third, those strict rules about loose metal are not there to scare you. They are what keep every single patient safe. If you have an MRI scheduled and you are carrying any metal, an implant, a clip, a tattoo, do not cancel and do not stay silent. Call your imaging facility and tell them exactly what you have. That single conversation is how they clear you safely. This video is for general educational purposes only and does not replace personalized medical advice, diagnosis, or treatment from a qualified healthcare professional. If you have any implanted device, always confirm its MRI safety with your ordering physician and your imaging facility, and follow the specific instructions they provide.